I ask that the quorum call be vitiated.
Without objection.
Mr. President, at 12:15, the Senate will vote on a Democratic proposal to overturn a Trump administration guidance from the Department of Health that would lower insurance rates all across America. Seems like a strange thing to do, but to justify that, the Democrats have come up with a scary fairy tale that has no basis in truth, that suggests that somehow this effort to lower insurance rates would jeopardize the protection for pre-existing conditions that all Americans have according to the law. And of course, that can't happen because the law doesn't permit it. So I want to talk about that a little bit today. What the Senate Democrats want to overturn is a Trump administration guidance using what's called a Section 1332 waiver. Now, a 1332 waiver was part of the Affordable Care Act of 2010 that Democrats passed. No Republican voted for it. So you had the Affordable Care Act, which says, among other things, that every American who has a pre-existing health condition is protected. That means that if I have a pre-existing health condition and I want to buy insurance, that I have a right to buy it, that I can't be charged any more for it because of my pre-existing health condition, and that I'm covered if I get sick. That's what we mean by protection for pre-existing conditions. So that's in the federal law. No American can be denied that protection. Now, in the very same law, the Affordable Care Act, Democrats wrote another provision to give states more flexibility in how they spend Obamacare money with the hope they might be able to lower rates for Americans who have health insurance. That would be a good thing because in Tennessee, or across the country really, since Obamacare passed, rates have gone up 163%. And those especially hurt are people who make a little more than $50,000 or $50,000, say a songwriter in Nashville or a farmer like Marty that I ran into in the Chick-fil-A outside Nashville, who said, I can't afford health insurance. I have to pay $15,000 or $20,000 because I don't get any Obamacare subsidy. So states are trying to take advantage of this provision of the Affordable Care Act, Obamacare, that says states may have some flexibility in how they spend the money as long as, the law also says, you don't jeopardize pre-existing condition for anybody. Now, the best evidence that what we're talking about is a scary fairy tale is that 12 states already have used the 1332 guidance. Remember, this was the provision in the federal law that was designed to give states more flexibility in how you spend federal dollars. 12 states have already used that provision to lower rates. These are 12 waivers from states that have been approved by the Trump administration. And premiums have gone down in all 12 states as a result of this action. This is what the Democrats want to stop. They want to stop states from using this provision that Democrats invented in 2010 to lower insurance rates. That's why it's a scary fairy tale that only on Halloween anybody would imagine could come up with. Now, 7 of the 12 waivers that were approved by the Trump administration were under an Obamacare definition of Section 1332, and 5 were under this guidance that is the subject of the vote today. Now, for any state to get a 1332 waiver, the Center for Medicare and Medicaid Services has to approve it. That's Seema Verma. She's the administrator of that agency. She has made it very clear, number one, that none of the 12 waivers that have been approved jeopardized pre-existing health conditions for anybody. In other words, they did lower rates for some people, but they didn't hurt anyone's ability to buy insurance who had a pre-existing condition. Just because it helped some people didn't mean it hurt other people. And Seema Verma went on to say very clearly, to be very clear, the 2018 guidance, the one we're talking about today, does nothing to erode Obamacare's pre-existing condition provisions, which cannot be waived under Section 1332. In other words, the law that the Democrats wrote in 2010 do not allow states to waive the pre-existing condition. Seema Verma goes on to say Section 32 does not permit states to waive Public Health Services Act requirements such as guaranteed availability and renewability of health insurance, the prohibition on using health status to vary premiums, and the prohibition on pre-existing conditions exclusions. Furthermore, a Section 1332 waiver cannot be approved that might otherwise undermine these requirements. The administration stands committed to protecting people with pre-existing conditions. So, the bottom line is 12 states have already used Section 1332 waivers to reduce premiums. More states want to come up with other ideas to do the same. In none of the 12 states was pre-existing condition jeopardized for one single person. And Seema Verma says that it cannot be under the law in any of the other states with some sort of new proposal, and that if there were such a proposal, she wouldn't approve it. There's no doubt there's a good reason why so many governors, in fact, in many of the states that already have been granted waivers, have Democratic senators as well as Democratic governors. Many states are trying to reduce health insurance rates because Obamacare has driven those rates so high. In the 4 bipartisan health committee hearings I chaired in the fall of 2017, virtually every witness told our committee that the process of applying for a 1332 waiver was too cumbersome, too inflexible, and expensive for states to use. So in the fall of 2017, provisions to improve that waiver application process were included in bipartisan legislation that was proposed by 12 Republican senators, 12 Democratic senators. At one point, the distinguished senator from New York, the minority leader, Senator Schumer, said it was such good policy, every Democrat ought to vote for it. But in 2018, Senate Democrats blocked that bipartisan legislation, which would have, by the way, lowered insurance premiums by 40% over 3 years. And it became clear Democrats were refusing to change even a word of Obamacare. So I encouraged Secretary Azar and the administration to take a look at the Section 1332 waiver and within the current law, do whatever they could to give states more flexibility. 14 governors wrote the secretary seeking help to make 1332 waivers work so they could start lowering premiums in their state. So in October of 2018, the Trump administration issued new guidance with the much needed flexibility so states can use 1332 waivers. Now, Democrats who vote at 12:15 to overturn this guidance are taking away from their states a tool that has been used in 12 states already and that many other states want to lower health insurance rates, and in every single case without jeopardizing protection for pre-existing condition. That was the whole purpose of the 1332 waiver. That's why Democrats put it in the Affordable Care Act. That's why 13 states have approved those waivers, and 12 have been approved just for one type of solution called reinsurance. That's when you take some money and put it in a reinsurance pool, take the sickest people in your state, put them there. When you take them out of the other pool, it lowers rates for the people who are left. And you can do that with the same amount of money. You lower the rates for these people in the pool, you make sure the people who are sickest have insurance, and you don't take away anyone's right to buy insurance who has a pre-existing condition. In each of the states, health insurance premiums have gone down as much as 43% in some cases. North Dakota has seen the average Obamacare premium decrease 20%. Colorado, 16. Delaware, 13. Montana, 8. Rhode Island, 6. And you want to overturn a guidance that attempts to give states more of that same kind of flexibility to lower insurance premiums without affecting the ability of any American to buy insurance with pre-existing protection. There's no reason states shouldn't be able to do that. Let me give you an example of what this guidance that we're talking about today would mean. In 2017, Iowa submitted a waiver application that would have restructured the premium subsidies. That's the money Iowa gets from Washington under Obamacare. According to Iowa Governor Kim Reynolds, Iowa's waiver would have given 18 to 22,000 Iowans access to more affordable insurance. These were Iowans who made too much to qualify for a federal subsidy and were left behind by Obamacare skyrocketing profits. This might be a farmer in Iowa making $55,000 a year. No subsidy, $15,000 or $20,000 for an insurance policy. The rates would be lower under Iowa's proposal. Under the old guidance, Iowa's innovative waiver couldn't be approved. Now, with the new guidance, the one you seek to overturn today, Iowa can work with Administrator Verma to get the kind of creative waiver so 15,000 more Iowans can afford health insurance. And to be clear, to emphasize, just as with the other 12 examples that have been approved, no new waiver can be approved that would take away the right of any Iowan who has a health insurance condition to buy insurance and to buy it at the same price as if that person didn't have a health insurance and to be covered when you're sick. So it's simply a fairy tale, a scary Halloween fairy tale, drummed up by the other side for reasons I can't imagine, since so many of their states are benefiting from this 1332 waiver, to take away from states the ability to reduce health insurance. As I said earlier, any waiver that's approved, as 12 already have been, to help some people get lower health insurance cannot hurt another person in that state by taking away their right to buy insurance at the same price that covers their pre-existing condition. States with 1332 waivers include these states with Democratic senators who'll be voting today: Hawaii, Maryland, Minnesota, New Jersey, Oregon, Wisconsin. Do they really want to take away from their state the ability to lower health insurance premiums in a way that doesn't jeopardize pre-existing condition? That's pretty strange. Then Colorado, Montana, Delaware, Rhode Island, Alaska, North Dakota, the same. I think this just gets back to the point that Democrats have elevated Obamacare to the 67th book of the Bible. They can't change a word of it. Even though they wrote the 1332 waiver in the Affordable Care Act to give to states flexibility to reduce health care premiums, which 12 states now have done. And Democrats also wrote in the Affordable Care Act that you cannot take away from any American the right to buy insurance at the same price if you have a pre-existing health condition. That's been reaffirmed by the Trump administration. It's in the law. To suggest otherwise, as I said earlier, is a scary fairy tale dreamed up for Halloween, and I hope that all senators, especially from those states who have seen the 1332 waiver work so well, will vote not to overturn the guidance that gives more Americans a chance to pay lower health share premiums. Mr. President, I yield the floor.